Good evening, all. Myself, Dr. Kiran Varma, working as head of the emergency Yashoda Group of Yashoda Hospital, Malakpet. So, I welcome you all for this series of webinars connected by Department of Emergency Medicine, Yashoda Group of Hospital, in association with the SEMI and NBI. So, as you all know that we come up with an interesting topic on every week. So, this time we focused on MRCEM exams. So, because majority of the ER patients and residents are willing or interested to clear MRCEM exam for various reasons, like to strengthen their CVs, or to get more and more credentials, to get better salary, to expose to different countries, to enter different countries. So, reasons could be varying from person to person. So, MRCEM, to clear MRCEM is not any easy. At the same time, it is not too difficult to crack it. But only thing we require is proper guidance and systematic way of reading. So we need some senior mentors who throws light on it, and who helps us in preparing while appearing for exams and while sitting for exam. So here we have senior most ER physician, Dr. Venkat Kotamraju. Venkat Kotamraju, sir. So who is consultant emergency medicine, CESR program, director and teaching lead, Royal Debris Hospitals, UK. He is also training program director, exams health education, East Midlands. So the short introduction, I would like to welcome Dr. Venkat Kotamraju, sir, to give some tidbits for clearing MRCEM intermediate. So I welcome Dr. Venkat Kotamraju, sir. Venkat, sir.
Yeah, thank you very much, Dr. Kiran. Thank you for the kind introduction. If you allow me just a moment, I'll just share my screen and then we can get going. Sorry, give me one moment. Am I able to share it the other way around? Or?
Yes, sir. We are able to see it.
Yeah?
Yes, sir. We are able to see it.
Okay, thank you very much. So that's great. And thank you so much for having me to talk about the MRCEM intermediate tidbits. A little bit more about me so that you know why I'm probably the right person to be able to give you some advice about MRCEM. So I did my MRCEM almost about 16 years ago when the MRCEM was introduced. Of course, now you know the MRCEM intermediate SBA replaces the FRCEM intermediate SAQ. So when I did it, it was short answer questions, but now, as per the new Royal College of Emergency Medicine 2021 curriculum, it has moved to an MCQ and single best answer question format. I have been training trainees for the last 16 years since the exam was introduced. And I covered trainees across 8 hospitals, 150 trainees. And in my own hospital, I have got a very large CESR program, and which is the largest program in the country at Derby, and we have been successful in training over 50 candidates, and 30 of whom are on the specialist register. Also, I have been the clinical lead for MRCEM and FRCEM exams for a large organization which conducts courses. So that is my background and credentials. And what I thought is I'll give you a very brief introduction, but I'll throw open the floor to questions because I know there's a lot of specifics that probably the trainees back home would like to know. And one advice I was given, because I was very fortunate to have worked with a very senior colleague who was the chief examiner for RCEM, And subsequently, he was my consultant colleague, Dr. Manjeet Singh Riyad. Unfortunately, he succumbed to COVID in April 2020, but he was the chief examiner and he wrote almost all the SAQ questions when it came into being. And he was an examiner for over 20 years for the college. And if some of you are fortunate to come into the college at Octavia House in London to take the OSCE, you will find that there is a big portrait of Manjeet in the college office, honoring and dedicating him because he was a fantastic human being, a very excellent clinician and a thorough examiner. And he was very fair and honest. And the tip he used to give is, for the exams, the things that you do on the shop floor by means of observation, by means of your clinical practice and the various procedural skills and the management tips that you undertake will go a long way in helping you to crack the exam. Of course, I realize for trainees who are overseas, this is slightly different because you're not in a UK setting. But nevertheless, the tips that I'm going to give hopefully will help you. And then I'm sure you will have lots of questions around which we can have a little bit of discussion and a question and answer session. So as I said, it's the new format based on the new curriculum of 2021. And it focuses on the specialty learning outcomes for year 1 to 3. The exam really looks at whether you are able to perform your clinical duties to someone who is about to start year 3, year 4 training while you are working on the shop floor. That is what it really focuses on. And hence, all candidates really, they are strongly advised to familiarize themselves with the year 1 to 3 specialty learning outcomes in preparation for the exam. As you know, it's an MCQ paper. You have 180 single best answer questions. You have 90 questions across 2 papers, 2 hours each. So total of 4 hours examination time. It's conducted on the same day, and you have a break of 1 hour between papers. And the blueprint is really to talk about the areas that you really need to focus on and where the 180 questions are distributed across. It is very, very important to note that the college takes the curriculum very seriously. They will sample questions exactly mapped to these specialty learning outcomes. So the top 3 or 4 things that you will look at are the complex stable patient, which is the majority of your clinical curriculum covering 60 questions. Resuscitation and organ failure learning outcomes 8 covers about 40 questions. That excludes major trauma, of course. And then injured patient will cover 30 questions. So you can see that nearly about more than 50% of the exam questions are covered by these 3 SLOs, 1, 3, and 4. And if you include pediatric emergency medicine, it almost covers more than 2/3 of the exam questions. Procedural skills and basic anesthesia, a few more questions. And then the reason I have put complex challenging patient in a different category is this is where trainees overseas, be it from India or the Middle East or Pakistan or wherever outside the UK who are taking the exams will particularly find it challenging in the real sense, because it talks about legislation, medico-legal stuff, guidelines, evidence, safeguarding, so on and so forth. So this is an area really for you to focus, because trainees here are exposed to complex, challenging patients every day during their clinical shift, and they will pick up clinical clues as well as clues for the exam when they look at these patients. But that is something you all miss out on. But nevertheless, it's only a small percentage, and some of it is covered by reading around guidelines. Okay, so under four categories, the four P's. One is planning, second is preparation, then practicing, and then it's the big day where you actually have to perform in the exam on your D-Day. So how do you really plan? Of course, for somebody who is taking MRCEM B, I assume you would have got through A. You have to look at the exam calendar to see when the dates are being published, when is the dates for applying opening up, when is the closing date, and it is good to plan somewhere 4 to 6 months in advance for the exam. Very, very important that you go onto the RCEM website and you review the regulation and the information pack. It's about 10-12 pages long, and it clearly mentions about the eligibility criteria, the number of attempts you have, the blueprint for the exam, some sample questions, and it will give you everything that you need to know about the exam. And the third thing is about gathering information. When I say gathering information, it's about talking to your friends, your colleagues, your mentors, your teachers, as well as your friends, particularly who have passed the exam previously, and more so who are now currently working in the UK. Because they are a valuable source of information, and they will give you guidance about how exactly you need to prepare. You need to be preparing smart for the exam. If you prepare too much, it is unlikely that you will crack the exam. It is not about how much you really know. It's about how much you know about what the exam expects you. So you may be thorough with Tintinelli, you may be thorough with Rosen, but that is not going to really stand you in good stead for the exam. It will stand you in good stead for your clinical knowledge as a general practitioner on the shop floor on a day-to-day basis. But for the exam, there are certain specific things that you really need to do. And that is called smart reading, smart focusing, and trying to be really very clear about your goals and objectives and mapping your preparation to the curriculum. And then collecting resources. When I say collecting resources, is there are various resources that you need to look at in terms of evidence. We will go through more in detail in the next few slides, but in terms of evidence, in terms of guidelines, in terms of looking at ECGs, in terms of looking at various X-rays, looking at pictures of various rashes. So you have to be very clear about what is in the curriculum and then try and collect resources. When I did the exam, people used to say, if you want to look at some picture, you Google the picture, and usually the first 2 or 3 pictures that appear in Google Images is the one which the examiners use. That used to be the case several years ago. But now the examiners who write questions, they have their own pictures from cases they have seen in their own hospital. Of course, they're all anonymized. So there are no patient details, patient confidentiality is preserved. So it is not necessary that you might find the same image in Google Images. But if you look at similar pictures and you are familiar with the picture well in advance, or the ECG for that matter, then it becomes much easier for you to be able to answer the question. So that's in your planning stage. You don't want to start planning 2 or 3 months before the exam. You need to plan well ahead of time, and you need to give somewhere between 3 to 6 months to prepare. Even trainees here in the UK find the SBA part of the exam much difficult to pass than the OSCE, because it covers a huge area of the curriculum. And the trainees are not particularly exposed to some of the minor injury stuff like minor injuries and minor illness, because that you have different people to take care. We have emergency nurse practitioners who look after minor injuries. So the amount of exposure to trainees to injuries, which is not major trauma, is sometimes limited. And of course, when you have questions around these, if you haven't seen them on the shop floor, then it becomes difficult even for them. So how do you prepare? You have to look at the various RCEM guidelines. RCEM has got lots of guidelines which are on the website, and you really need to be able to answer questions from those guidelines. And it is very imperative that you download each and every guideline. There are best practice statements. There are guidelines which are frequently updated, and no doubt questions will be asked from those guidelines. You need to know the guidelines in and out, particularly at least familiarize yourself with the flow charts which are at the end of the guideline, because lots of questions are asked. And I'll tell you about the ways in which questions are asked and how to really look at a question. RCEM Learning has got several resources on learning sessions. There are over 200 learning sessions, which are again written by people who work in the UK under the guidance of consultants who are, most of them are examiners, most of them write questions. So, and it is mapped to the curriculum, it is mapped to the guidelines, be it RCEM or be it NICE guidelines, and they provide a very, very useful resource. So they are learning sessions. I always tell my trainees, and even after 21 years of emergency medicine experience, I do this every single day after my clinical shift. Every time I see a patient who is on a particular day, I come back home and look at the guidelines. I read around the topics and I familiarize myself with the latest evidence-based practice. I do this every single day, and I've been doing it for the last 21 years. That is because it keeps me up to date in terms of enhancing my own clinical knowledge, as well as keeps me up to date because I teach on a lot of courses and I have a lot of trainees who are taking exams, and I should be able to answer questions when they ask me. Then NICE guidelines. Of course, there are lots of topics which have NICE guidelines related to them. And it is always good practice that you sit down with 2 or 3 colleagues and write down the list of topics and make a list of the various NICE guidelines. Only recently, when I conducted a course in Calicut about a couple of weeks ago, I came to know that you cannot open the NICE CKS website. NICE CKS is a fantastic resource which the general practitioners use, which we use every single day on the shop floor to look up stuff, to read around stuff, to reference stuff, because it is taken from the NICE guidelines, as the name says, but they are, when it is CKS, so it is clinical knowledge summaries, and they do it in a very nice fashion in terms of providing a case. Then they go through the stepwise manner of diagnosis, management, treatment plan, criteria for referral for the general physicians from the primary care to the hospital. And it's given in nice bullet point format. So it's easy to read, easy to digest, easy to recollect. But it's a shame, of course, you're not able to access these. But if you have friends or colleagues who are there overseas, they might be able to make some little notes for you and provide them. It is a UK exam, so you need to be thorough with resuscitation guidelines, advanced life support, not the American guidelines. I'm sorry to say that, although you do the ACLS and majority of you or a lot of you are instructors on the ACLS course, and the American Heart Association. It's a UK exam. You need to follow the UK or the European guidelines. So ALS, Advanced Life Support Guidelines on Cardiac Arrest and Special Circumstances, and so on and so forth. ATLS, the college accepts the European trauma course, but I still feel the questions are still taken out based on your ATLS guidelines. Then European Pediatric Life Support or Advanced Pediatric Life Support for the pediatric guidelines, and then the Neonatal Life Support for the neonatal guidelines. Sometimes BNF can be a useful resource and they ask questions pertaining to the BNF. For example, a very recent question from the FRChem exam was on methoxyfluorine, or the penthrox that we use. So they asked few questions around, and it specifically mentioned according to the BNF, which is the contraindication, so on. It's not very common, but we use the BNF as a resource to look up for drugs, look up for adverse reactions, look up for interactions, look up whether the drugs are safe to prescribe in pregnant patients. So that is about your preparation part. Now, when I say practice, I put it, practice, practice, practice. I can't stress this enough. You need to be practicing loads and loads of questions. It is not enough for you to just read up guidelines, look up stuff, read the material, read a lot of theory. You must practice questions, and I can't stress that enough, because when you look at a question, you must be able to tease out what is being exactly asked of the question. We'll go through in the next slide how you will tease out a question and how it really helps you to answer, and what is the examiner thinking. So when you are practicing a question, you must be able to put yourself in the position of the examiner. What examiner wants me in this scenario? What are they likely to ask? And most of it is based around clinical stuff. Nobody is going to ask stuff that you don't encounter on the clinical arena commonly. There are some topics which you may not commonly see in the ED, but the questions are asked in the exam, but it will still be based around a clinical theme. So you must be able to tease that out, and the only way to do it is to practice questions. You can practice question based on the SLOs, you can practice topic-wise questions, or you can choose random questions. If you look at the RChem website, there is a section which says what resources will help me in my preparation for the exam. And possibly you might have access to those resources on the day as well, particularly the levels, of various normal values, ranges of various values that are there, which is available to you, because people write the exam from all over the world and systems of practice are different. So they give you the normal range of values followed in the UK. And there is also a glossary of terms, which is about 3-4 pages long. Please go through this word by word. Please read them, underline the important keywords, and digest them. The reason I have put the glossary of terms here, if there is anything for you to take away from this, is for you to look at the glossary of terms, because the questions will be based on these glossary of terms. Rest everything that I've spoken so far, you can get it from the RChem website. You don't really need me to tell you that the exam has got 180 questions. But the glossary of terms is really, really important. This is where people fail to focus, and there are various terminologies, but I have picked up. So if you pick up something like definitive management treatment, what does that indicate? So if the question asks you about what is the definitive management for this particular scenario, or what is the definitive management? It means it includes things that you would normally do in the department, but usually requires you to list the operation or the procedure that will cure or contain the condition. So it's very, very important to understand what they mean by that. Or it may also refer to the gold standard treatment, which has proven to give the best results. It may not be available in the place where you work, but that is the gold standard treatment or investigation, whatever you may call it. Essential. When we call about essential, what do you mean by the term essential? Essential means, again, life-saving treatment or management steps that are a priority. Life-saving treatment or management steps that are a priority, but they don't include things like analgesia and communication. So you need to be very clear about that. Recommended. What do we mean by the term recommended? Means is the best treatment. This is the best treatment according to a national guideline or accepted practice. So these, you look up the glossary of terms and it gives you very, very clearly about these. And the questions will be asked around these terminology. Which is the best management step? Which is the most appropriate step? Which is the next step in the management? Which is the next immediate step? Which is the most likely cause? Which is the recommended treatment for this particular condition? Based on the criteria which is applied here, what is your management step? So something like that. Criteria means you have some sort of a guideline and there is some formal international national guideline or scoring system that allows you to define the seriousness of the condition. For example, CUB 65 for pneumonia guideline or Wells scoring system, some sort of scoring system which will help you to plan. So this glossary of terms is very, very important. And when an examiner is setting a question, they have this glossary of terms in front of them. And they will refer to these glossary of terms and they will likely read what the glossary of term exactly means. And they will try and develop a question around this. So if you are aware of what the glossary of terms are, then it will become much more easier for you to be able to tease out the question. And now it's the final day, you've come to the exam and to perform. But before you perform, you need to do these things even when you are practicing the questions. Stems are usually long. They won't be 1 or 2 lines. They're usually 4, 5, 7, 10 lines. You need to read the stem carefully because you've got only a minute to read the question. So you have to read the question, read the stem, then you have to pick out the keywords. The keywords will help you to narrow down the options. You have to pick out the keywords from all the stems. After you've picked out the keywords, usually every stem will have a pointer and will have a distractor. You may not know that, but it will have a pointer and a distractor. There will be some clues in the stem which will point you towards the answer, and there will be some clues which will be negative, which if you don't pick up will distract you from the right answer. So it's very, very important for you to quickly read the stem. The only way you will be able to read it quickly is if you have done lots of questions. If you haven't done questions, you have done a lot of theory reading and you haven't practiced questions, then you will find it extremely difficult to be able to do that on the day of the exam. So read the stem carefully, pick up the keywords, underline them or, memorize them. Of course, it's on the computer now, so you can't really underline, but at least you can keep them in your memory. Look for pointers or distractors. You may not necessarily have in every question lots of pointers, but there will be something in the question from the keyword, which should help you point to the right answer. More often than not, you will be able to exclude 3 of the answers, options out of the 5 very easily. And you will be able to narrow down to the 2 most likely options. And this particularly you find it challenging in questions where they ask which is the most appropriate next step, which is the most appropriate treatment. So when it says most appropriate means all of them are appropriate, but amongst them for that given stem, which is the most appropriate you need to choose. So once you have narrowed down to the 2 most likely options, go back, look at the keyword, look at are there any pointers, distractors, and usually that will help you to narrow down to the exact answer. And before you put down the answer, read the stem. When I say read the stem means not word by word. You must be able to read them, skim reading, smart reading, and very quick reading. So just have to just focus on some key areas. And sometimes they will have some trick things, all of the following except. So you have to be very careful when it says, you might read all of the following and forget except, and then you put the wrong answer. So be very careful when you're reading the stems. You will get this when you do lots of questions. Okay, so it's not how much you know that counts. As I alluded to before, you might know a lot of stuff and you might have mastered, the various textbooks and things like that. It's not about how much you know, but how much of what you know that you can recall under stress. Exam is a stressful condition for every one of us. And you must be able to recall what you have read on that particular day. And the key to doing this is smart reading. Smart reading means when you read, you must be able to make up your own questions. You don't need somebody else to write the questions for you. You can write your own questions. And you have to prepare in a bullet-wise fashion. There's no use of preparing pages and pages of notes. You have to prepare in a bullet-wise fashion. For example, let me give you an example. Say there is a question about Lyme's disease. You don't need to know about prevalence, incidence, and all those things. You have to know about 8 or 10 points under Lyme's disease. What are the 8 or 10 points? What is the key thing in the history? They will say outdoor activity, or there will be a stem which says somebody went into some of the American countries for hiking, outdoor activity. So you need to know that keyword. Secondly, what is it? The organism Borrelia burgdorferi. What rash does it cause? Erythema chronica migrans. What are the clinical features? Usually, if you have them, you will end up with bilateral facial palsies. You will have cardiovascular abnormalities like heart blocks. Okay. Treatment. Now, the treatment is very, very important because treatment is in 3 categories. Everybody knows the treatment is doxycycline. Examiner also knows you know that. So he twists the question and he says, what is the treatment in an 11-year-old child? You know, in children, doxycycline is contraindicated. So you have known everything about Lyme's disease, but on the day, if a question is asked about children and you haven't read the antibiotic in children, then obviously you won't know the answer. So this is what I call by smart reading. So the answer is it's amoxicillin in children below 12 years. Now you know what is in the adult, what is in the children. What else the examiner could ask? They could ask a question about what is the drug of choice in somebody who is pregnant. And then you go up to the Google and look up a picture of erythema chronica migrans. So this is about the smart reading. And then once you have read this, you read about other rashes that can be possible because you've seen erythema chronica migrans. So you have to go and read about how a picture of a HSP rash looks like, how erythema nodosum looks like, how urticarial rash looks like. And then you build questions around it. So from one question, you can, or from one topic, you must be able to resource, reference various topics in a very, very smart way. Finally, if some of you are taking the exam next Thursday, all the very best, or you're planning to take the next one, I think the next one is 8th of February, 2024. I put my email address there if you need any help, any guidance, or you have any doubts about it. And that's my telephone number. You can WhatsApp me, and I'll be only too happy to help and guide you. But I've kept this presentation deliberately short because I want to have lots of interaction based on the questions, because I know lots of you will have lots of questions. So thank you very much, and I look forward to taking your questions now.
Thank you, Venkat sir. Thank you so much for your tidbits. So I think it would be helpful for the people, those who are preparing for the MRCEM intermediate. Any questions? Naveen sir, any questions in the? So far, no questions.
Yeah, people can actually type in the QA section or chat box.
I think no questions so far, sir.
That's surprising, because I thought there will be a lot of questions, and that's the reason I kept the presentation relatively short, under half an hour, 40 minutes, because I really wanted good interaction. I'm sure you have questions, so don't. How can we get through trauma? Questions.
There are questions start coming up. So how can we get through trauma questions?
Okay. What do you exactly mean by how can we get through trauma questions? It's a huge topic. Trauma, obviously, you have two types, right? One is minor trauma, and then the other is major trauma. Major trauma, there are major trauma guidelines. When you say fractures, so what you need to do about fractures is you go to the common. So you start from the upper limb, for example. You look at, say you look at the shoulder. So what are the common things that we get in the shoulder injuries? It's usually either shoulder dislocations, or you will get neck of humerus fractures, or there will be some stuff around rotator cuff tears. So there will be questions around that, really. If it is part A, it's very easy, because they can ask which is the most commonly injured nerve in anterior shoulder dislocation, or which nerve is at risk. In part B, in the intermediate, it's a little bit more difficult. So usually they'll give you pictures around X-rays, and they might ask you which is the next best step, or which is the definitive management, things like that. So you progress from that, look at stuff, look at injuries which can commonly affect the elbow. For example, if you have to affect the elbow, there might be question around your Crittall criteria for pediatrics, around the growth plates. Or you might have questions around an X-ray shown, and the X-ray has just got a posterior fat pad. So if it has just got a posterior fat pad without an obvious fracture, what is the most likely diagnosis? Most likely diagnosis in an adult is usually they will have a radial head fracture. So things like that. So for trauma fractures, you have to look at lots of X-rays. You have to go through the common treatment modalities, and you have to go through the definitive management principles. Major trauma, of course, there are major trauma guidelines.
There is one more question, sir. Can MRCEM all parts be taken in one single year?
That you have to ask the college. I don't know about this, because it all depends on when you are appearing, when your results come, and when the window opens for the next exam. There is no, I don't think the college puts any restriction on time period, that you can't take the exams within the year, within 18 months, within 24 months. But I think the way it works is by the time you apply for one sitting and you write the exam and then you get the result, the window for the next sitting opens and closes. So that is, you have to write that question particularly to exams@rchem.ac.uk. Anything else?
Yes, sir. So what topics to refresh in last 5 days?
Okay, there is something called as high yield topics. Last 5 days and last 3. If you haven't practiced in the last 4 to 6 months, it is very unlikely that you will crack in the last 5 days. This is not an exam which needs to be taken lightly. Okay. Here, even in the UK, I don't know the exact percentage. I don't look at the percentage because my trainees in my region, the percentage of first-time passes is somewhere between 95 and 100%. That is because this is the only deanery in the country which has got a training program director, particularly for exams. My job is to train people for the exam. I don't have any other job other than clinical. Of course, I have my own clinical job, but I am appointed as the training program director for exams. So all trainees, when they are taking exams, they come to me and say, this is my date, and this is when I'm taking the exam. And because it's part of the deanery and they are part of the deanery, it's free for them. So we form a WhatsApp group and I do sessions with them and we go through loads of questions. I don't go through guidelines because guidelines are available on the RChem website. There is no point. All I do is go through one question, and from one question, I branch out into 10 or 20 questions, and that covers the whole syllabus. So I can't really tell you what are the things to practice in the last 5 days, but certainly what I can say is, please do not go into the exam without looking at the guidelines. You can't memorize them page by page. You have to be smart about it. You have to be smart about guidelines. So when I say be smart about a guideline, I'm a toxicologist. I do toxicology every single day, but I do not memorize the guideline. For example, there is a guideline on suspected internal, drug trafficking, people who conceal the drugs. So there is a body packer, there is a body stuffer, and there is a body pusher. Okay, that's a guideline which has got about 15-20 pages. You don't need to read about all those things. You have to pick out the keywords. In one of them, the packets are well packed. In the other, packets are loosely packed. One of them, they conceal drugs to hide from the police. So one of them, they don't. Are they symptomatic? Are they asymptomatic? Look at the guideline. Finish. That's all you need to know about it. That is what I call by smart reading. If you memorize the guideline word to word, you may be okay if you are doing a long answer question in the DNB, but you won't pass the MRCEM because this is single best answer. So when I say high yield topics, 5 days, look at the blueprint and see whether you have covered every single topic on the blueprint. Just follow the blueprint. Questions will be asked according to the blueprint. Examiners will write questions, but when somebody is picking out the 180 questions, they will make sure. And some of you who have taken the exam previously, the reason I say that is I don't want anybody to go in for a second attempt. But unfortunately, it happens sometimes. You get your feedback. And when you get your feedback, you will know each and every theme that has been talked about. And that will be exactly the 180 questions according to the blueprint.
So one more question, sir. Is MRCEM success enough to pass the test?
Okay. I'm not here to give you any opinions about various resources that are available. I don't use that resource. So my honest answer is I don't know. I do my own questions. So I don't know the honest answer. How can you pass the exam? You can pass the exam by what I have told you. That's not because I'm saying that, you have to follow one particular thing. There are lots of resources. I'm not here to lobby for one particular resource, and I will not take the names of these things. I have lots of resources which I've been told about, because you are free to use any resource you like, and you're free to refer to things, but the exam focuses on RCEM guidelines, NICE guidelines, and RCEM learning. And the questions, of course, you can use from resources. You can talk to people. People can tell you about the various themes that come, but the college is very strict about this. And I'm going to be very professional and say, you're free to use what you like.
Smart answer, sir. This is a smart answer.
Okay, there is no official question bank, right? The college does not release any official question bank. Any particular website or any particular ones you're using, you need to look at the credentials of the person who is setting the questions. Okay, who is an authentic person to be able to give you advice? Somebody who is working in the UK, somebody who is working at a consultant level, somebody who is an examiner, somebody who writes questions for the college, somebody who trains their trainees, and those sort of things. Okay.
So how to distinguish trifascicular blocks or bifascicular blocks in ECG?
Well, you have to go through ECGs and look at the guidelines, because this is not a session about clinical. We're not talking about clinical topics here. So I will restrict my answers to only questions related to the exam, as opposed to going in detail. Again, having said that, I also don't say to people, you have to come and attend my course or you have to do this. No, you don't need to attend any course to pass the exam. You need to practice the guidelines. You need to practice with your own team. You need to practice with your colleagues, and you need to practice with your trainers because they give you. So for me, the reason I'm presenting this, because I have a very unique position in our deanery, and based on experience, we have approached the deanery and the School of Emergency Medicine to say that this might be beneficial for the trainees. So this special post was created. It's only in our deanery, not every deanery. But what people do is they have their own educational clinical supervisors. They go and discuss the questions with them. They sit down with them on a weekly or a fortnightly, monthly basis, and they sort it out. Unfortunately, this is not a US exam, so please do not go and look for US questions. They might give you some idea, because the clinical stuff is the same. But it is a UK exam, so it's very simple that they expect you to follow the UK guidelines and the UK systems, because the rules, particularly around legislation, around safeguarding, around medical legal stuff, is quite different in the US compared to the UK. Clinical stuff may be the same, because the same organism will cause Lyme's disease, whether you are in the UK, India, or in the US. It's not going to change. It's not going to suddenly become Staphylococcus for Lyme's disease. It's still going to remain Borrelia. Some of the things are common, but the college is very, very strict about three things. And I would like to point this out for people there. Firstly, there is no official question bank that the college releases. Because if you imagine, if you want to write a question, it takes a lot of time. And the people who write the questions are full-time practicing clinicians. There is nobody who is just sitting at home doing questions and not doing anything else. So it takes a huge lot of work. And because this is a recent curriculum 2021, there are not many questions with the college bank. So the questions more or less sometimes will be repeated. However, I have to point it to you that this is very, very important. However, the college has also become very smart, because college is not blind. It knows that people leak the questions outside. Okay, so it changes the questions. It will change the same question to mean differently. And if you have known the question and you have mocked up the answer and you have gone and said, oh, fantastic, this question already was leaked to be my friend who wrote the previous exam. Please be aware that you will be fooled and you will be more than likely putting the wrong answer. So the college is very strict. It knows about people who are doing some sort of illegal stuff and unethical stuff. So be very careful. How about recalls? I don't know about that. I will not answer any questions which are controversial. I'm only here to help you pass the exam.
So then one more question, sir. What is the percentage of questions you need to get correct before you prepare examination?
Okay. So when the college sets the question, they set 180 questions. And then they very carefully, they are reviewed by a panel of senior clinicians to look for any errors in terms of the terminology, look for any errors in terms of, wording which might confuse them. So you have 180 questions, and then they calculate something. In the olden days, when there was a SAQ, we used to be a bunch of 10 people or 15 people. We go and take the exam ourselves. So we write the whole exam. The examiners used to write the whole exam, and then with the exam is corrected. And then every single question, we used to decide the level of difficulty. That was for short answer questions. And for short answer questions, we used to have 20 examiners sitting in a room and to mark the paper. And we used to discuss and we used to see the level of, but of course now that system is no longer existing because it is a single answer question and it is computer marked. And they take something called as the Angoff method plus one standard deviation to decide the pass mark. So the pass mark in the autumn setting may be 120, for example. The pass mark in the spring setting, depending on the questions and the difficulty, may be 114. But if you have to ask me for a number, so if you should aim for somewhere between 130 and 140 to be on the safe side. But there is no set number. I cannot tell you that if you get 140, you will pass. If you get 110, you will fail. It all depends on that particular sitting.
So any opinion regarding recent passing rates, sir?
Okay, I don't look at the fail rates because I don't want people to fail. But I think somewhere between 60 and 70% is the realistic answer. It may be plus 10% more or less. All I'll say is this is a difficult exam. It's not an easy exam, but if you have the right strategies, if you have the right mindset, and you have the right resources to prepare, there is no reason why you should take it the second time. All you need is having some focused preparation. But generally, it is much difficult than the OSCE to pass. So even my trainees, if they struggle with this SAQ compared to the OSCE.
So how to tackle the questions in exam?
I just told you, right? I told you the 5 things. You look at the STEM and you have to pick out the keyword. You have to pick out the keywords. Because this is not a clinical setting, I haven't put in any questions. You have to pick out the keyword for the question. You have to look at pointers and distractors. There will be pointers and distractors. And then you will more or less, more often than not, 3 of them will be little bit different, so you can eliminate them easily. And you will have a dilemma between 2 answers. And more often than not, you will pick out the wrong one, because that's what the examiner wants you to do, right? He wants you to pick out the wrong one based on your, and that is human nature. So you tend to lean towards that. That's why I say, before you put the answer out of the 2, go back and read the STEM very, very carefully. And this will come with practicing lots of questions. If you practice lots of questions, you will straight away know what is the keyword, and you will know the keyword from the glossary of terms. Usually there will be a keyword for that clinical stem, and there will be a keyword from the glossary. You marry both of them together, your answer will be there.
So then, please talk about SLO7.
What is SLO7? Complex and challenging patients. Yeah, I told you. So SLO7, complex and challenging patients, includes things like medico-legal, safeguarding, legislation, information governance, evidence, and guidelines. So the RCEM, if you go to the RCEM website, it has got about 15-20 pages, a document on. So there are a few documents on, for example, Mental Capacity Act, mental health patients in the ED. Police bring the patients on a section 136 to the emergency department. Acute behavioral disturbance. Things around consent, capacity, those sort of things. And things around advanced directives and power of attorney. These things, obviously, it takes almost half a day, 1 day to prepare. But people here are exposed to these daily in and out. That's why I highlighted that it will be a difficult topic for people who are not practicing in the UK. But if you do questions around it, and consent, what is the consent to give police for obtaining blood samples? So there are about 6 or 7 guidelines which the RCEM covers, and 6 or 7 on learning sessions on the RCEM learning, and this should cover this SLO7.
So how important are sports, laws and acts in UK, like Mental Health Act, those things, sir?
Yeah, they will ask you only those which are relevant. We are not psychiatrists. So they are not going to ask you in-depth questions. They will ask you questions related to that pertinent to the emergency department. For example, under section 5.2, what is the time you can hold somebody in the ED? 72 hours. Something like that. Okay. Or they might ask you about domestic violence, elderly abuse, non-accidental injury, and link that to a mental health problem. So you don't need to know too much about, nobody know consent. Only you need to know 4 things. Somebody understands, they retain, they weigh up the information, they are able to communicate. Things around Gillick competence, Fraser guideline. So there are about 8 or 10 topics which you need to know.
Yeah, good, sir. I think we covered up all the questions. So if any questions are left out, we'll answer in person. Okay. Anything you want to convey, Venkat, sir, apart from all these things?
No, I think we've covered quite a lot of stuff, and
yes,
all the best for whoever wants to prepare, and I've given my details. So if you need any more doubts or any more questions, or you won't have any more clarification, I'm more than happy to help. And I'm sorry that some of you might have been disappointed that I haven't pointed you out to any particular websites or resources or those sort of things. They are all a little controversial, and I don't want to get into those sort of controversies. All I would say is you all have enough knowledge. All of you are hardworking, and all of you have put in efforts to become good clinicians, and that is what we want to do. So really, it's just about putting things in the right perspective, having the right frame of mind, and preparing smartly, as I call it.
Thank you, sir. Thank you, Venkat, sir. So I thank everyone for attending this session. Then I thank Dr. Srinath, sir, and Yashoda Group of Hospitals. I thank SEMI Board and NBI Board for supporting all our events. I thank Ananda.